Hello guys and welcome back. In this video we are going to talk about aortic regurgitation. Thank you for all your support. Don't forget to like this video and to subscribe to my channel. So let's start with aortic regurgitation. Aortic regurgitation is the third most common valve lesion with increasing prevalence secondary to an aging population. Transthoracic echocardiography plays a vital role in the identification and assessment of aortic regurgitation and proves essential in monitoring severity and determining the timing of intervention. So, what is aortic regurgitation exactly? Aortic regurgitation, also known as aortic insufficiency, is the leaking of the aortic valve of the heart that causes blood to flow in the reverse direction during ventricular diastole, from the aorta into the left ventricle. Aortic regurgitation is the third most common valve lesion, accounting for approximately 5% of adults undergoing intervention for severe valvular heart disease. As with other heart valve diseases, aortic regurgitation is more frequently encountered in older individuals and therefore presents an increasing health burden with an aging population. Echocardiography is central to the diagnosis, monitoring, and clinical decision-making of patients with aortic regurgitation. Now let's talk about the aortic valve anatomy. The aortic valve is composed of the left ventricular outflow tract, aortic annulus, aortic valve cusps, and aortic root to the sinotubular junction. The aortic valve typically has three semilunar cusps attached to the aortic wall, associated with outpouching or sinuses of Valsalva. The aortic valve typically has three cusps, but may also develop with 1, 2, or 4 cusps. The aorta itself is made up of 3 layers including the tunica intima, tunica media, and tunica adventitia, and divided into anatomical segments: the sinus, the sinotubular junction, and the tubular aorta. In normal anatomy, the left and right sinus give rise to the respective coronary artery ostia. The 3 sinuses are positioned between the aortic annulus, and the billowy shape of the sinuses facilitates aortic valve opening in systole without obstruction to the coronary artery ostia. The sinotubular junction is a tubular structure at the junction between the commissures and the ascending aorta, just distal to the sinuses of Valsalva. Now let's talk about some variant anatomy of the aortic valve. The aortic valve may also develop with 1, 2, or 4 cusps. Bicuspid aortic valves are the most common anatomical variant, with a prevalence of approximately 1% and a familial preponderance. Bicuspid aortic valves are commonly associated with aortic regurgitation and ascending aorta dilatation, premature valve dysfunction, and increased risk of aortic dissection. Onychospid and quadricuspid aortic valves are rare, with an approximate prevalence of 0.02% and less than 0.01% respectively. Quadricuspid aortic valves is more often associated with aortic dilatation and aortic regurgitation, whereas unicuspid aortic valves usually present with aortic stenosis. However, all dysfunctional aortic valves frequently develop marked calcification, which may impede the ability to clarify anatomy. In such circumstances where we have a dysfunctional aortic valve, alternative imaging should be considered to establish the morphology of the valves. Irrespective of the presence or absence of valve dysfunction, all patients with variant anatomy should undergo echocardiographic surveillance owing to the high risk of disease progression. Close attention should be paid to aortic dimensions, and family screening should be offered to first-degree relatives. Now, let's talk about some of the causes of aortic regurgitation. Any condition that damages the aortic valve can cause aortic valve regurgitation. Causes may include heart valve disease present at birth. This includes a bicuspid aortic valve, onychospid aortic valve, or quadricuspid aortic valve. Another cause may be aortic stenosis. This is a narrowing of the aortic valve. Calcium deposits can build up on the aortic valve as you age. The build-up causes the aortic valve to stiffen and become narrow, and it prevents the valve from opening properly. Aortic stenosis also may prevent the valve from closing properly. Another cause of aortic regurgitation may be endocarditis. Endocarditis is an inflammation of the inner lining of the heart's chambers and valves. This life-threatening condition is usually caused by an infection, and it can damage the aortic valve. Another cause could be rheumatic fever. This condition was once a common childhood illness, and strep throat can cause it. Rheumatic fever can cause the aortic valve to become stiff and narrow, in turn causing blood to leak. If you have an irregular heart valve due to rheumatic fever, it's called rheumatic heart disease. We also have other health conditions. Other rare conditions can cause the aorta to get bigger and damage the aortic valve. These include a connective tissue disease called Marfan syndrome, and some immune system conditions, such as lupus, also can lead to aortic valve regurgitation. And the last cause of aortic regurgitation can be a tear or injury of the aorta. The body's main artery is the aorta. A traumatic chest injury may damage the aorta and cause aortic regurgitation. So might a tear in the inner layer of the aorta called an aortic dissection. Now let's talk about some of the symptoms of having an aortic regurgitation. As aortic valve regurgitation becomes worse, symptoms may include shortness of breath, tiredness and weakness, irregular heartbeat, lightheadedness or fainting, chest pain, palpitations, and swollen ankles and feet. And to finish, we have some of the complications of aortic valve regurgitation. This can include fainting, heart failure, endocarditis, arrhythmias, and death. Thank you for watching. Don't forget to like this video and to subscribe to my channel. See you on another day. Bye.